Hypertension, commonly known as high blood pressure, is a widespread and serious chronic condition affecting millions of people globally. It is characterized by persistently elevated blood pressure in the arteries, which, if left untreated, can lead to severe health issues such as heart disease, stroke, kidney failure, and other critical conditions. Therefore, it is crucial to manage and prevent hypertension effectively. This article provides a comprehensive guide on how to control hypertension through medication and lifestyle changes, reducing dependence on drugs. 1. Reducing salt intake. Reducing salt intake is the first step in managing hypertension. Excessive salt causes the body to retain too much fluid, leading to increased blood pressure. Control salt use in cooking. When cooking, try to minimize the amount of salt used, keeping it to less than a pinch. Also, avoid adding extra salt at the table. While our bodies need some salt, the salt in processed foods and added during cooking is usually sufficient. Excessive salt intake promotes water retention, which can lead to elevated blood pressure. Note that sea salt and kosher salt contain the same amount of sodium as regular table salt, so switching types of salt won't reduce sodium intake. Avoid processed foods. Processed foods often contain high levels of salt and other additives, such as sodium benzoate, which is used as a preservative. In addition to the salt used in cooking and at the table, many packaged foods are also high in sodium. Sodium promotes water retention, leading to increased blood pressure. When shopping, check food labels and opt for low salt, low sodium, or no salt added products. Prepackaged, canned, and bottled foods often contain a lot of salt, including meats, pickles, olives, soups, chilies, bacon, ham, sausages, baked goods, and injected meats with higher sodium content. Also, avoid pre-made condiments like mustard, salsa, hot sauce, soy sauce, ketchup, barbecue sauce, and other sauces. Track daily salt intake. Many people consume up to 5 grams, 5,000 milligrams, of salt daily, which is considered very unhealthy. While it's not necessary to completely eliminate salt, it's essential to keep daily intake below 2 grams, 2,000 milligrams. You can track your sodium or salt intake by keeping a food diary or using a health tracking app. Low-sodium diets typically involve consuming 0 to 1,400 milligrams of salt daily, while moderate sodium diets involve 1,400 to 4,000 milligrams of salt daily. Consuming over 4,000 milligrams of salt daily is classified as a high-sodium diet. Remember that low-sodium salt contains potassium chloride, which may not be safe for some people, so it's better to choose sodium-free substitutes like lemon juice, flavored vinegar, fresh herbs, salt-free spices, and mixed spices. 2. Changing dietary habits. Changing dietary habits is another crucial method for controlling hypertension. A balanced diet can help reduce blood pressure and support overall health. Eat in moderation. Your diet should be balanced and nutritious. It's recommended to focus on plant-based foods, eating more fruits and vegetables, and reducing the intake of meat, dairy, and eggs. Aim for at least one meat-free meal daily, mainly consisting of fruits and vegetables. For example, you can have a salad made from several cups of leafy greens for lunch, with added carrots, cucumbers, celery, and sunflower seeds. Additionally, opt for lean meats and fish, like skinless chicken or salmon, and low-fat dairy products. Avoid high-sugar and high-fat foods. High-sugar and high-fat foods like candy bars, processed carbohydrates, and red meat should be avoided. While these foods may taste good, they offer little nutritional value and can be replaced with healthier options. For instance, choose fruits instead of candy and opt for white meats like chicken and fish instead of red meat. Increase fiber intake. Fiber does not directly lower blood pressure, but it aids digestion and supports overall health. Most vegetables are rich in fiber, especially leafy greens. Many fruits, nuts, legumes, and whole grains are also high in fiber. Aim to consume 8 to 10 servings of fruits and vegetables daily, and try to diversify your diet to ensure you're getting enough fiber from different sources. Consume foods rich in omega-3 fatty acids. Omega-3 fatty acids are crucial for heart health, but many people do not get enough in their diets. It's recommended to eat fish rich in omega-3 fatty acids, such as salmon, mackerel, and herring, at least twice a week. These fish can help lower blood pressure and promote heart health. If you're eating canned fish, don't discard the fish oil, as it contains high levels of omega-3 fatty acids. You can also consider taking fish oil supplements, but it's essential to research the product's quality and source before consuming. Increase dietary potassium intake. Potassium is an essential nutrient for maintaining health, but excessive intake can be harmful. It's recommended to consume 3,500 to 4,700 milligrams of potassium daily, especially for active individuals. Foods rich in potassium include bananas, tomatoes, potatoes, beans, onions, oranges, fresh fruits, and dried fruits. Consult a doctor about supplements. Some natural supplements can help lower blood pressure, but they should not replace antihypertensive medication. Research has shown that supplements like coenzyme Q10, omega-3 fatty acids, fish oil, garlic, curcumin, ginger, cayenne pepper, olive oil, nuts, black cohosh hawthorn, magnesium, and chromium can help lower blood pressure. However, always consult a doctor before starting any supplement. 3. Reducing stimulants. Reducing stimulants, especially tobacco and caffeine, is key to managing blood pressure. Quit smoking. Nicotine and other stimulants in cigarettes can raise blood pressure. Quitting smoking can lower blood pressure, improve heart health, and reduce the risk of other diseases like lung cancer. If quitting is difficult, seek help from a doctor who can prescribe medications or recommend smoking cessation programs. Reduce caffeine intake. Caffeine is a central nervous system stimulant that can cause emotional agitation, increased heart rate, and elevated blood pressure. If you already have high blood pressure, it's advisable to stop drinking coffee, soda, and other caffeinated beverages. Gradually reducing caffeine intake can help avoid withdrawal symptoms such as headaches. Lose weight. Excess weight puts extra strain on the heart, leading to increased blood pressure. By eating a healthy diet and regularly exercising, you can lose weight, reduce the strain on your heart, and effectively lower blood pressure. Avoid recreational drugs and alcohol. The abuse of drugs and alcohol can damage organs, especially the liver and kidneys, leading to increased blood pressure. Many recreational drugs are stimulants that can increase heart rate, raising blood pressure. Quitting these habits can help control blood pressure. Regularly monitor blood pressure and consult a doctor. Regularly monitoring your blood pressure can help detect changes early and take appropriate action. If your blood pressure is consistently at or above 140/90 mmHg, it's essential to monitor it closely and consult a doctor for a personalized treatment plan. 4. Relaxation techniques. Stress is a significant factor in hypertension, and relaxation techniques can help lower blood pressure. Reduce chronic stress. Reducing daily stressors, such as high-risk business transactions, can help lower stress levels. Chronic stress causes the body to release stress hormones, putting the cardiovascular system under strain and raising blood pressure. By managing time effectively and adjusting lifestyle habits, you can reduce the negative impact of stress. Take baths and practice meditation. Taking a 15-minute hot bath can temporarily lower blood pressure, especially before bedtime. Meditation and deep breathing are also effective relaxation techniques that can help slow your heart rate and lower blood pressure. Walk or engage in other moderate exercise daily. Engaging in moderate exercise, such as walking for 20 to 30 minutes daily, can effectively lower blood pressure. Walking is simple and can help reduce stress, promoting overall health. Conclusion. Managing and preventing hypertension requires a combination of medication, dietary changes, and lifestyle adjustments. By reducing salt intake, adopting a balanced diet, limiting stimulants, and incorporating relaxation techniques, you can effectively control blood pressure and improve overall health. Regular monitoring and consultation with a healthcare provider are essential for maintaining optimal blood pressure levels.